I'm Professor Hayes. Thank you for joining us. It's brilliant that you've been able to join us. Our aim is for this session to be informative and thought-provoking and engaging. We'd like you to send us questions, but first I have to do a couple of etiquette points. Could you please turn off your video and your microphone? Could you also bear in mind that the session is being taped, so we can put a copy up on the Institute of Employment Rights YouTube channel for people who've missed it. So bearing that in mind, if I take a question that's been proposed, I won't identify who's asked the question. You can feed in a question by typing in the chat box that you should be able to find somewhere on your screen. Some of you might be new to the Institute of Employment Rights, so if I tell you a little bit about it, the Institute informs and educates people about employment laws and the law governing trade unions and health and safety laws, indeed law that's about working life and working people. And it brings together trade unions and UK academic lawyers and industrial relations experts and barristers and solicitors in employment and labour law. So it doesn't just follow developments in law, it drives change and informs legal development for the benefit and in the interests of working people. It's not just about rights in the workplace, but it's also about promoting values of democracy and equality. I'm delighted to be chairing this webinar, both because of the topic and also because I get to chat to two brilliant people this evening, Faiza Shaheen and Roger McKenzie, and as well as time and technology willing getting to take your questions too. I want to say something to introduce the topic because equality is always a work in progress. And we can't possibly talk about equality now without talking about the pandemic. And we can't talk about the impact of the virus itself without also talking about the legal, political and industrial response to the virus and how that set the scene for a pandemic that touches different people's lives in different ways. And who has been hurt most by coronavirus? People with disabilities, people without good quality housing, Black people, African Caribbean, Pakistani, Indian, Bangladeshi, migrant workers, those with insecure employment, those who are unemployed, asylum seekers, the homeless, women, particularly women with paid and unpaid caring responsibilities. And indeed, these groups of people who are most harshly impacted by the deadly virus are those who are most disadvantaged at work. And the connections between health inequality and poor quality employment have been carefully noted by an eminent professor of public health for at least 10 years now, Sir Michael Marmot. And he's been warning about the way in which relative privilege is leading some people to lead longer lives, and disadvantage means that other people experience earlier deaths. And he's recommended that to reduce health inequality, we need fair employment and good work for everybody. And his vast data collection has proven that negative health consequences accrue to people who are under lots of stress at work, people who are low paid, people in part-time work, people who are employed on 0 hours contracts. And the Office of National Statistics is compiling a picture of the deadly impact of coronavirus and COVID-19 by occupation. And that's telling us that for women, the highest death toll is for women who work in care work. And for men, the death toll is highest for taxi and cab drivers. And we know that both of these occupations are synonymous with poor quality employment and discrimination based on race and gender. So with a focus on coronavirus, we have to necessarily focus on equality as a class issue. and that's the subject of tonight's discussion. So I want to begin with a question to Faiza, because we know that underlying health conditions make people particularly vulnerable to coronavirus. But the IER and organisations like CLASS, the organisation that you head, have been warning for a long time that the underlying health of the economy makes the UK vulnerable to the harms of inequality. So can you tell us, please, about what you think coronavirus is revealing about economic inequality in the UK, Faiza?
Great, thanks for having me on the Zoom call tonight. And I completely agree with your introduction there in that this is about health inequalities and this is about class. I think the thing that's has been most stark to me, and we just spent the last few weeks even going through a whole bunch of statistics looking at the last 10 years of what's happened to the labour market and looking at what's happening right now, is exactly that point, that it's the working class are in a double bind, because they're either on those 0-hour contracts, working in hospitality, and the first to let go and be let go and their hours cut. So they've had the economic hit, and we see that very clearly in our data. When we ask workers if their hours have been affected by COVID-19, it's higher for those on less than 20 grand a year. Who's working from home and who can't work from home again. And then on the flip side, it's either that the working class are hit by the economic impact, or they are the frontline workers. I mean, it's quite striking that 1/3 of our key workers are on less than £10 an hour. I mean, think about that. These are people putting their lives on the line, going out when the rest of us have been asked to stay in, and they're paid nothing for it. And so, this really is a working class struggle, what we're seeing right now. And one of the things it also reveals, and I know most of us on this call will already have got this, is just how multi-ethnic the working class is. This has been a big part of the work that we've been doing at CLASS and our research, because we've been so angered about this narrative of the white working class, of that the working class is just in the north, it's male. You hear it even in some of the language that the Labour Party uses around Northern Heartlands. And what COVID-19 has shown us and opened our eyes to is, who's driving the bus still, who's still delivering your parcel, who's looking after your parent in a care home. And one of the things I found most frustrating really is that we're not talking about class very much. If you look at the sort of general public debate, we're not talking about the role the working class is playing right now in keeping the wheels on society. And in particular, reminding people that the working class is multi-ethnic. This is such an important time to build that solidarity, to stop that divide and rule agenda of the white working class against the immigrants. And just let me tell you how much that has seeped into the minds of the Black and brown working class. When we did a big piece of research, and you can find it on the CLASS website, called We Are Ghosts, which is a quote taken directly from these interviews with working class people. When we'd come to the end of the interview, and we'd, especially ethnic minority working class, we would say, do you consider yourself working class? And most of them would be confused about the term and say, well, I can't be working class, can I? Because I'm not white. And, these are direct quotes that we would hear. So, we're missing an opportunity here to talk about class, because it is the working class that has been most affected, whatever way you want to look at it. And it's deadly. Reminding people who the working class are and building that solidarity amongst them. So I think that's one of the things that is most stark to me, looking at this moment and looking at the statistics. In terms of economic inequality, I mean, one of the things that many of us that have worked on this agenda for a while have been saying is that, look, there's too many people in precarious situations. We went from, in 2010, about 200,000 people on 0-hour contracts to 1 million now. And again, when we did our survey, and you can find it's our most recent report on the website, the Workers' Emergency, those that are part-time 0-hour contracts or self-employed, because obviously it's a lot of bogus self-employment that has happened with Uber and the rest of it over the last 10 years and more. We you know, it's exactly those people that are being affected. So, you know, really the way in which we run the economy and the way it's generated economic inequality has, sort of metaphorically speaking, left the forest very dry. So as soon as any spark comes along, you know, we're in real trouble. And I think one of the things that we have to really work to do at this moment, because one of the most pernicious effects of economic inequality is that it divides us, makes us have less empathy for people. So like the way in which they were able to talk about benefit scroungers, and for us to have less empathy for people, for them to be able to make the drastic cuts that they have to welfare, is that we have to really stir people's emotions. And on that, there is some positive news, because in our survey we found that overwhelmingly people want bus drivers, supermarket workers, to care workers, to of course NHS staff, to all have a pay rise. And that is, you know, the public's eyes have been open. So whilst the government obviously, you know, doesn't care about that agenda, you know, that is where we need to be pushing right now. Economic inequality has become deadly, and it's become emotional, and people can see it.
Yes. So I wanted to ask you a little bit about the change in the political environment that we've seen over the last 6 months. Jeremy Corbyn was elected to lead the Labour Party on a platform of eradicating economic inequality, and an essential component of Labour's policy agenda was to support trade unions with a new suite of laws which would have enabled trade unions to better represent a diverse group of people and be more effective at redistributing wealth. So now that Jeremy's leadership has ended, are you still hopeful that progress can be made?
I guess on the one hand, whether it be NEU or whether it be, you know, TC and others' involvement in pushing for the furlough scheme, people are seeing that they need someone to stick up for them. And I think especially in regard to NEU, in the way in which they're sticking up for teachers, and whilst, you know, the Daily Mail was trying to demonize them and vilify them as we'd expect, and the Tories are, you know, obviously pushing back there, they actually do have a lot of support, because either you're a teacher or you know, you might have a child in school. So I think that there is a moment here where people can maybe recognize the importance of trade unions, but I don't think that the Labour Party is really pushing enough on that. And I guess my concern is, and you can see it a bit with the reluctance to support NEU and teachers, and the sort of bit of silence there, I think, is you have to be really brave to back the trade unions, because they're so demonized, right? You have to be on the side of the trade unions, you're going to get clobbered by the Daily Mail, right? Because that is their thing. And, you know, obviously they always make out the trade unions are the bad guys. Like, you've got to go out and really be willing to make the argument as to why unions are so important, and they are. You know, this is a reminder of that, in particular around health and safety. And I just haven't seen that willingness to really stand and show solidarity at this point. And that might change, but I think, you know, it will take the left within the left movement, within Labour, to push to make sure that we are backing the unions. And we're proud of that, because unions are the most effective way to deal with inequality. Let's be clear about that. It's not just some, you know, romantic notion of trade unions. The fact is, and, you know, I came to the trade union movement through statistical analysis, to be quite honest, in my geeky way, looking at what will address economic inequality over the long term. And again, all my regression analysis and all of the various different studies I was looking at during my PhD and afterwards would say, look, you just cannot tackle inequality without unions on your side. So, you know, I want to see the Labour Party be far more vocal about that, and really back NEU and others that are, you know, really pushing at this time.
I think that that's a really important message about the connections between trade unions and equality, and also that tackling inequality means challenging existing systems of power, and that means that we have to be brave if we are going to advance equality. So I wanted to turn to Roger, because Roger has a long-standing record of advancing race equality issues in the labour and trade union movement. So Roger, to what extent do you think that the coronavirus crisis has revealed the racialisation of labour markets and the disadvantages experienced by Black, African Caribbean, Bangladeshi, Pakistani, Indian and migrant workers?
I think it's fairly obvious to see, really. I mean, I think you only have to look at the kind of figures that we're hearing about how many Black people are being affected by this virus to understand the impacts. And it's not an accident. And I have to say, what is happening here is that people are deliberately, in my view, being put in harm's way. And they're being put in harm's way because we have a prime minister, frankly, who just a few months ago was using terminology like pickaninnies and watermelon smiles and all of that kind of insulting language. So it wouldn't matter to him and a whole number of other Tories that the people who are being put in harm's way the most. Or seem to be affected the most, in fact not seem, absolutely are being affected the most, are people in the Black community. So I think it's very revealing in lots of ways. I think it's also really important because it's to point out one other thing. I think sometimes it's like, I mean, I've been in a lot of these debates and discussions over the last couple of months. And it's almost like people have there's been a kind of sudden discovery about inequality. Some of us, many people on this call, I know, because I can see some of the names, have been involved in these discussions for a very long time. This is not new. What it's done is it's provided a sharp focus around some of these issues. But, you know, you could go to something like the TUC Black Workers Conference, every year. You could go to Unison's Black Members Conference. Unison's Black Members Conference, the biggest gathering of Black workers anywhere in the Northern Hemisphere, actually. It's a massive conference, about 800 people. And these sorts of issues that we're discussing now, that we're actually able to have a discussion about because of the pandemic, have been discussed for years, and people have not been listening. And you know, I'm afraid, you know, I mean, it's really frustrating when it takes the death, multiple deaths of people that you know and love, and you have been raising these issues for so long, and people haven't been listening to you. Low pay, treatment in the workplace, the way that it's so difficult just to get transport from where you live to get to work, the quality of the housing that you live in, the food that you're able to access where you live. All of these things contribute towards what's happening at the moment. So in a way, I'm I was going to say half pleased, but I'm not even half pleased. I'm kind of relieved in a way that people are finally listening to what we've got to say. What I hope is that this isn't the end of that kind of conversation, because, you know, frankly, we've been here before. 27 years ago, a few weeks ago, that Stephen Lawrence was killed 27 years ago. And I remember what happened at that time, and people were asking exactly the same sort of question that you did, Lydia. It's not a criticism of you at all, but it was the same sort of discussion, and people were almost raising their hands saying, yeah, we admit to being institutionally racist, we admit to this, that and the other, we have working groups set up here, there and everywhere to try and deal with it. Even across the trade union movement, all of these bodies were set up to try and deal with things, and some little things started to happen. Some things were addressed, including within the trade union movement, in many employers, but for a little while. And then interest went off onto something else. And I hope, well, in fact, I don't care whether I'm sounding harsh about this, actually, because this is how many of us feel. that it takes a tragedy for people to actually sit up and listen to some of the things that we're saying. So if I sound angry, it's because I am, because I've lost friends in this pandemic, black and white, actually. But I've seen too many black people being put in harm's way without PPE, without any consideration by employers for their safety, just lip service quite often. And then I see a prime minister who frankly has already revealed his true colours, and then I'm expected to try and find some kind of theoretical way of being able to deal with this. I don't. I see people who are treating the black community in this country with utter contempt at the moment.
And clearly you're right to be angry, Roger. There must be a real risk that if we end up with a public inquiry as a supposed remedy to injustices, that we are going to risk all of these issues being kicked into the long grass and being managed politically. And what we need is a shift in power. So knowing that trade unions are crucial within that, what legal reforms do you think are needed to support trade unions to be able to renew that fight for equality at this time?
Before I come on to that, let me just say I'm absolutely in favour of a proper independent inquiry into what's gone on. There has to be a day of reckoning about what's been going on at the minute, and the Tories have to pay for this, frankly. But in terms of the legislation, the question that you asked, let me start off by answering what I think shouldn't be the legislation that we should have rather than what we should. And what we've seen this week is a piece of legislation that is absolutely underlining the point about treating people, the communities, treating working people with utter contempt, and that is the new Immigration Act, I think it is now, really quick. The whole thing's been pushed through, dividing working people against each other. So people will stand out on a Thursday evening, applaud workers, applaud black workers, applaud migrant workers, without whom the National Health Service, without whom the care industry would not survive. And then they bring in an Immigration Act to divide working people against each other. It's the age-old tactic. And we have to be really firm against that. And to be honest, I was quite upset to see some Labour MPs voting to support that. They should know better. And we have to raise our voices about these things. So in terms of legislation that I do think that we need, many of our staff working in social care, many of our members working in social care just now across the social care sector. Particularly, I'm thinking at the moment of some of the people who seem to be the most vulnerable, who are working in the private sector, care sector. Many of those people I know are working in some of those care homes. They're coming to those jobs through agencies, but through those agencies, they are being forced to be registered as self-employed. So one of the things that I think we need to look at as part of the whole kind of consideration of what needs to happen within the care sector is a real close examination back to this question that we looked at before the election about bogus self-employment, because frankly, people are being forced to be self-employed so you can get on an agency's books so that you can go to work and put bread on the table and keep a roof over your family's heads. Then there is something fundamentally wrong with that. I was talking to my uncle earlier on today, and he was telling me about his care workers who he's managed to recruit into Unison, which I'm really pleased about. And he was telling me about their conditions, because and I think Faiza said something about this. So many care workers who are working for a pittance at the minute, and those care workers who were working to care for my uncle were getting a pittance. They, barely at the minimum wage, barely, right? In this day and age, right? And I think that's something that has to be looked at. So the whole question of 0 hours contracts, I think proper rates of pay. But for me, one of the key issues, and it is a legislative issue really, is for me, we have to look at bringing the whole of that care sector back into public ownership, frankly. I think those arguments, Labour might have lost the election, but that argument I don't think has gone away. People are being treated really, really badly across the care sector generally. But some of those private care companies have really got a lot to answer for. And frankly, again, this is another example where it's not just something that's just been happening now. This is something that's been going on for some considerable time. It ain't been good in the care sector for ages. And now you've got a load of private sector care companies who are looking to make amends. Now, loads of them ain't really bothered about quality of care. They're interested in the profit. That's the nature of what they're in it for. And we have to expose that. So I think that's one of the things that we want to look at as well. The final thing, if I may, I just want to add to this. We need to look at the strengthening of equality legislation. I don't think we should let that argument go. But one of the things that I've seen all my years of working on race equality work at various levels over the years, it's okay having strong equality legislation or having equality legislation, strong or not. But what you absolutely need is proper enforcement of those laws. And frankly, we haven't got enforcement of anything to do with equality as far as I can see at the minute. So whatever we do in terms of new equality legislation, whatever we call for in terms of strong equality legislation, running alongside that must be a call for proper enforcement of that legislation as well.
Thanks, Roger. You mentioned some issues to do with the current government there, and I wanted to come back to Faiza and ask her about her views on that, because this government was elected on an agenda of what they called levelling up. And there was undoubtedly recognition at the last general election that inequality was a pressing issue. And since then, we've seen a Conservative Chancellor pumping unprecedented volumes of cash into the labour market. So Faiza, do you think that one of the legacies of coronavirus is going to be that there will be a lasting change to economic orthodoxy that we've seen in recent years?
I want to be hopeful about that. I was just starting my career when the financial crisis happened and felt then that finally people are going to realise and the neoliberal agenda will end and we'll regulate banks more and the rest of it and redistribute wealth and income much more. And of course, we got the opposite. We got 10 years of austerity. And I think what's clear from the way in which Rishi Sunak and the government is behaving is that they see a difference between the emergency measures. So yes, they have made this intervention in terms of the furlough scheme and the rest of it, although they keep talking about that as if it's the number one in the world, and it's not. IFS put out some good research last week just saying that actually we're sort of mid-table compared to other European countries. But there's that distinction between the emergency measures that they have to take, otherwise there would be millions and millions of people without incomes overnight, and longer term change. And I think it's been quite striking that there's no plan for the longer term. So our research found that 1 in 5 workers are completely unconfident that they will have their same job that they have right now in 6 months' time, which is around the time that the furlough is apparently going to be completely phased out. And we know whether it be Rolls-Royce today, whether it be, British Airways, we are hearing constantly about companies saying, we're going to make all of these people redundant, regardless of the furlough scheme. So we know that's coming down the line. But do we hear anything about job creation program for young people, for instance, who are always disproportionately affected by recession? No, we don't. Do we hear anything about a good green stimulus program that does something about regional inequalities, gives jobs to good well-paid jobs to non-graduates, levels up the labour market in that respect? No, we're not hearing anything. Are we hearing about care-led growth, you know, what we're going to do on care? Because ultimately, I mean, it was quite shocking today to hear on the news, I can't remember which minister it was, saying, sort of blaming the fragmentation of care homes, saying that they were privatized as sort of like an excuse for why they couldn't take action. So the next step is then to say you're going to bring that in-house, right? But there's no plan on care. And, you know, I've just, it's so frustrating. And, you know, I feel Roger's frustration. And, you know, I just get this sense that the blueprint, I had someone else say this yesterday, the blueprint is still the same for the Tories. And we could see that in the immigration bill, which is disgusting. And we could also, you know, we can see that in the way that they won't even say to companies, we'll bail you out, but you've got to stop putting your money in tax havens. They won't even do that, which a lot of European countries are saying, fine, we'll give you the money, but you're not putting your money in tax havens anymore. Just simple things that they could do, like scrap the immigration bill and tell companies that we're not going to bail you out or give you loans if you're squirreling your money away in tax havens. And they're not doing that. So for me, it just seems, I think it was, you know, the most striking example of that is hearing, you know, the Prime Minister, Boris Johnson today, literally say, oh yeah, you know, nurses from abroad saved my life, but then go on to defend the NHS surcharge. They have learned absolutely nothing. It's not in their interests to change things and to change things fundamentally. So you do have trade unions at the table planning going forward. So we do have a green stimulus program. So we do change the care, fundamentally restructure the care sector. And so, yeah, it won't come from this government. I mean, it would have to be ideologically very different for that kind of change to come. But there is a way in which we can galvanize people, and trade unions are very important in that, because I think the way into this whole conversation is to talk about this term low skilled, which makes so many people angry now. You know, I did this tweet right at the beginning of this whole pandemic and lockdown, maybe a few days in, and just said, oh look, you know, 3 weeks ago Priti Patel was talking about low skilled constantly in her immigration bill, but look at who is going to be out there right now. And I think I was shocked. I think it got something like 153,000 likes, and it went around the world. Like my family in Canada were like, oh, we just seen your tweet on some. And it just really demonstrated to me that there is a way in there. People get that injustice. You know, they're angry about the fact that care workers, if we keep saying it, and this is really on us as commentators and people that are out there in the community, we have to keep saying it. More than half of care workers are paid less than £10 an hour, less than a living wage. You know, it's a real living wage. You know, it's shocking. And some of you would have seen the video that's been put out by a young Syrian man, Hassan, who works, I think, in the local hospital here, in fact, at Whipps Cross, you know, saying, Prime Minister, I've been cleaning the hospitals, and I've just seen that you have a policy that says that if I was to die, my family wouldn't get a right to remain. You know, this is what I mean. I'm an economist and a kind of geeky quant person by background, but you know, the emotional stories are there. And we have to, you know, people have hearts, like they do care, and this is the way in which we need to go forward to really start, I think, with the care sector. And you know, I'd love to talk to you about that, Roger, later on. But I mean, one of the things I've got a question for you actually is, you know, how can we make it stick? You know, in all of your years of doing so much organizing and campaigning, you know, what would you say, it's a bit cheeky of me to ask Roger a question, but what would you say, you know, would help us to not just say or put all of these ideas in a report and then for it to fizzle out and for us to get, you know, to get nowhere on it and to see in a year's time that nothing's changed? Like, what is it in your experience makes change stick?
Well, what makes change stick is solidarity, strong union organisation, collectivism, and the will to do something about these things. One of the things that I see more than anything is that we're kind of programmed into having polite conversations about these things. And I don't do polite conversations when people around me who I care about Unison members, I care about working people generally. when I see people being deliberately put in harm's way, and when I see people who are just being treated with such contempt, utter contempt by this government. And I will not have a polite conversation about it. But what I will do about those things is go out and organise. There's loads of Unison people I've seen who's on this call, and they'll know that that's what I always talk about, because I genuinely believe that that's what makes the difference, is when you have to turn the kind of anger that I'm showing into, there's a great writer called a poet and activist called June Jordan, who died about 15, 20 years ago, I think it was. And she always talked about creating places of rage. So it's not just an anger that just doesn't go anywhere, but you create a place of rage. And for me, that's about building a movement that's going to make a difference for working class people, all working class people, and not what we were being told before this pandemic, that actually that was just about white working class people, but all working class people. So, I mean, for me, building a movement is everything. And the fact that we lost the election, Labour lost the election in December, doesn't mean to say that those sorts of issues that we were talking about in the run up to that and that were part of that manifesto have changed at all. In fact, for me, they've got worse during this pandemic. It's as you were saying, Lydia, it's in sharper relief now, those issues. And I think we have to, I think we're almost in a position where we don't have to work as hard to get that message across about the state of things at the minute. But what we do have to treble our efforts around is building that movement that's going to make a difference, a movement not of the usual suspects, so just us all on this call who probably go to everything all the time, but actually widening that circle out to people who maybe haven't thought of being active in the progressive movements, if not the socialist movement, but the progressive movements before. Our recruitment in Unison is through the roof. And I know it is for lots of unions at the moment. What we have to do is to turn that into activity within our organisations. That's what will make the difference. A load of people who are scared now, but if you can turn that to some kind of anger and you can turn that into activity, that's the sort of thing that's going to make a difference. And some of that work is being done to us because people are being shown these figures every day about how many people are dying at the moment. They probably haven't realised yet they're not being shown the true figures yet, which is probably, I was looking at some pensions information the other day, it's in excess of 55,000 actually, are the real figures that we're looking at here, right? But when we get that information across to people and get people mobilised into some kind of activity, I think the best movement for people to get active in is the trade union movement through their workplaces. And if they haven't got a workplace, then join our movement anyway. I think that's what we can do. So that's the long answer to your question, but nobody else is going to do this for us. We have to do this ourselves.
Well, I wanted to talk about something which is a little more positive and feeds into some of the key themes that have come out of the discussion, particularly around the centrality of care and how we view care as part of our society and how care work is valued. But also that point you were making, Roger, about data and how we used data. And so I've been working with Unison and the GMB on issues to do with care workers. And on Monday, in the House of Commons, Matt Hancock, who's the Secretary of Health and Social Care, directed that additional funding to local authorities would ensure, was the word he used, that care workers received sick pay in the context of coronavirus. And this followed on from the publication of a new care home guidance package document, which had been issued. And we, at my team at Kent University, we'd undertaken research about the regulation of social care, and we'd analysed data from a survey that was done by Unison in the Northwest of care workers. And we found that 8 in 10 care workers they didn't believe they would get any wages if they needed to self-isolate. And therefore, because of fear of poverty, they were not self-isolating. And we reported concerns about different forms of poor decision making that were happening because policymakers, decision makers didn't really understand what care workers did. And there was a failure to uphold people's legal rights. And up until that announcement on Monday, the official advice from the government to social care employers had been that if care workers needed to self-isolate, then they could access statutory sick pay, which is £95.85 a week, which if we think of what the living wage is, £350 a week or £400 a week in London, you can see how totally inadequate that is. And the government hadn't acknowledged that the failure to provide occupational sick pay within the care sector was a major risk to public health, as well as being a gross injustice to this largely female, racialised workforce, and that care workers couldn't afford to stop working. And so we made recommendations to government. We then worked with Unison at a national level and the GMB to put in a submission to the Women and Equalities Committee inquiry into coronavirus. And then our report was filed in the House of Commons Library. Now, meanwhile, Unison in the Northwest was using the report and the data and this information about the 8 in 10 care workers to support their negotiations at local level with Liverpool and Wirral and Salford councils and elsewhere across the Northwest. And they've won commitments from councils about occupational sick pay. And those successes have been built on 5 years of dedicated campaigning and organising work that's recruited thousands of care workers into the union and has demonstrated the potential of unionisation to improve their conditions of work. So it was against that backdrop of these successes in bargaining locally that Navendu Mishra, who is the Labour MP for Stockport, was then able to table the question in the House of Commons, asking Matt Hancock about sick pay and government support for care workers. And this was the first time that there had been a direction from government to say that care workers ought to be paid wages when they need to self-isolate, when they need to shield themselves, when they need to protect other people. And it was also important because it was a recognition that the government ought to have a responsibility to fund this. But the route, the points that you were making about privatisation mean that the fact that Matt Hancock has said, well, we've given this money to local authorities and we are directing them to make sure that no care worker suffers detriment, that in itself does not mean that care workers end up getting more money in their pockets and that they are able to self-isolate. And the reasons for that are to do with the legal relationships which have been broken around issues to do with employment and responsibility and local authority oversight and the ability of government to intervene within a privatised sector. So it means that local authorities will have to rely on legal mechanisms around contract because they are contracting with these private organisations to deliver care services, and to try and tie that to contractual conditions that this sick pay is made available to care workers. And also issues to do with the way in which these organisations are regulated, because care organisations have to have a licence to be able to provide care. And even though the regulatory framework that exists for the registration to be able to continue is largely focused around the safety of users of care and support services, what we've been doing is examining how those regulations, which are about safety of care, can be used to support arguments around terms and conditions of work for care workers. And so this process is ongoing, and it is going to require trade unions to be in there at the coalface, negotiating and bargaining and stepping in around these issues to do with compliance and enforcement to ensure that workers actually get what they are entitled to. But I wanted to share that with you as something which was positive about, you know, the effectiveness of trade unions and how it's possible for us to use data and key messages in the current context to begin to lever changes, whilst recognizing that any step forward, we need to make sure that that actually secures gains for working people. And so I wanted to see if it's possible now to open to some questions that we've had from our participants. And one of the questions that we've had is to do with any investigation that there might be into the crisis of coronavirus in respect of the NHS. So what's being said here is that in investigations relating in the NHS to inequality in the workplace, what's discussed here as being the snowy white peaks. So I think that this is to do with race issues in the NHS. It's saying that those issues seem to be swept underneath the carpet or kicked into the long grass. So what can be done about that in respect of what's happening now in terms of holding people to account in the NHS? I think that that's a question for you, Roger.
While I mean, I do support the need for, as I think I said earlier on, for an inquiry into what's going on. And I think having a racial dimension to that is really, really vital. You know, I mean, my hesitation here is because of this. It's because I've seen lots of inquiries in my lifetime about lots of different things. And one of the things that I'm most convinced about is that inquiries will respond to pressure, collective pressure. And if there's no collective pressure on those inquiries, then it will be a whitewash in inverted commas, or it will be a kind of, it'll be, you know, we'll all be upset at the end of it that nothing's really going to change. So it goes back to the point that I made earlier on about the need for organising to take place, which incidentally I think is extremely positive. That it's something that it gives us an opportunity to organise around something that I think people really understand what's going on at the moment, probably better than many politicians think, that they understand it because they're at the sharp end of what's going on, and they are stuck indoors and that they are having to isolate. So in terms of an inquiry, I think we have to be really clear about what we want to see included within inquiries, but we have to build the movement around it. The final point that I make is that for me, the biggest example of all of this is that, again, I'll go back to the Stephen Lawrence inquiry report, and I think the spotlight that was placed on that and the organising that went around it meant that we got some, not everything, but we got some real change because of it. So my message to everybody would be, don't just wait for an inquiry to take place and just sit there and pray that at the end of it, they're going to come out with something that's useful or that actually makes a difference. We have to force that difference. And again, I think it was Alice Walker or maybe June Jordan who once said that we are the ones that we've been waiting for. You know, nobody's going to come to our rescue. No one's going to do this for us. We have to force the change. And I think we'll have to provide the pressure on the inquiries to bring about some real difference.
Mm-hmm. Thanks, Roger. Is there anything you'd like to add to that, Faiza?
I guess just one thing I've been made really aware of, just looking at loads of think tank reports on what's happening in the labour market, and this very clear signs that, you know, women and ethnic minorities being disproportionately affected and are on lower pay in terms of the economic hit. It's just how hard it is for people to talk about racism and racial discrimination. And it just seems to me, I know I want a proper public inquiry as well. You know, I agree with Roger, but, you know, they could easily pick the easy things, or the things that are less controversial. And, you know, in this country where it's, you know, you get more hassle for calling someone a racist than being a racist, yeah. I worry that we won't ask those fundamental questions about, you know, racism and sexism that is built in within our economic structure. And so, yeah, I mean, I think that's a really important element here, you know, how we get a public inquiry to really look at that question as well, and not just, you know, blame black and brown people for having lower vitamin D. I mean, I'm just so annoyed about the whole conversation right now.
Yeah. An interesting question for you, Roger. Will unions be able to cope with an influx of new members?
Yes, of course, but it goes back to a point that I made earlier on. You know, I'm an organizer. It's probably pretty obvious. That's all I've talked about all night. But my job within Unison is not just to you know, get new members in just for the sake of getting new members. My job is to work out how we build a movement, and I think that that's what trade unions should be about. It's not just about collecting members so that we can go around and say, well, we're the biggest union ever in the history of the known universe or whatever. You know, actually, it's got to be for a purpose. And for me, that purpose is to get power, is to build power for working people in their workplaces. So for me, yeah, of course we can deal with having more members. The real question, if I may be so bold, is can we deal with getting more activists within our unions? Because that is the task that we've got to do. More people doing things within our unions and giving them support so that they can get the job done at a local level.
Yeah, yeah. So it's clear that to tackle some of these issues to do with equality and inequality, we need new structures, new laws, new systems for the regulation of work. And one of the things that the Institute of Employment Rights has spent a very long time working on has been bringing together the UK's leading employment and labour law experts to put together a manifesto for labour law, which is about the reforms that are necessary to bring our regulatory structures up to date so that they are fit for the 21st century workplace and fit for the issues of inequality that we face, and are also able to provide trade unions with the support that they need. And one of the key issues, I think, for the social care sector is for us to move towards a system of sectoral collective bargaining across the care industry. And I know that this is something which is now supported by the TUC in Wales, in the UK, in England, in Scotland too. There has also been an amendment which has been tabled in Scotland this week, calling for sectoral collective bargaining in care. So that debate is beginning to grow once more about the importance of including care workers in conversations and ensuring that care workers are represented nationally. And if anybody is interested to know more about that, I wrote a booklet for the Institute of Employment Rights, which is called 8 Good Reasons Why Adult Social Care Needs Sectoral Collective Bargaining. And that was written way before the crisis hit. But the reasons, the underpinning lack of power and inequality, which blights the terms and conditions of the care workforce, I think will only really begin to be remedied once we have these national structures for sectoral collective bargaining to happen, so that trade unions are able to do the job that they are established to be able to do, to enter into negotiations, to represent workers, to secure agreements, to negotiate with employers' associations, and to have a far more democratic and inclusive approach to the way that we regulate terms and conditions of work. I've got a question which might be of interest to you, Faiza, which is around the ideology of work and how we might be able to address some of the issues to do with the ideology of work, which I assume is about, you know, the significance of waged work, the separation between work-life balance, issues to do with caring responsibilities at home, exclusion of people from the workplace. So what do you think that could be done around some of these ideologies around work as a mechanism of I suppose, a way in which we value people or don't value people socially?
Yeah, I mean, I think it's really key. I mean, I think that's why there's sort of anger at this wider anger at this low-skilled terminology, which should just be banned. And you know, it's really about the commodification of humans, right? And this thinking of humans as cogs in the economic machine and just there to produce. And, you know, and we've seen that happen increasingly through the way in which labour law has been changed and regulations and privatisation, in which, you know, the employer is put into this narrow mindset of just thinking about what one produces. I mean, this is why I get so angry about the whole productivity argument. You know, it just really irritates me, because how do you measure productivity in something like care, which is one of the most important jobs? And so, you know, I think that's the place we need to start back talking about the decommodification of humans in the labour market, because we know some of the people that generate the most social value are paid the least amount of money. So I think that's critical. There was a letter in The Guardian about that from Thomas Piketty and Ha-Joon Chang and a whole bunch of people, although they didn't talk about trade unions, which is frustrating. And I think, you know, beyond that, we need to start thinking about the aspect of voice. And, you know, Roger mentioned, or you might have mentioned, power and the importance of power. So I think we need to start also pushing back on this sense of workers being passive participants. But actually, you know, if you ask people about their workplace, they are experts. And, you know, just the whole way, our whole language and narrative of how we talk about the economy, you know, I've done training before where people will come and they will say, can you explain the economy to me? And I'll say, you're the economy, you're part of the economy. What you do, your efforts, your work, your thoughts are what makes up the economy. And so, you know, I think the ideological values-based language that we need to use at this point is really, really important, that we don't repeat some of their sort of bad language and myths, and that we come in with a more human approach.
Yeah, thanks Faiza. That also fits with a question that I've had here about limited coverage of statutory sick pay. Now, while some workers do qualify for statutory sick pay, not all. Yes, it's asking about whether this issue needs to be unlocked for care workers who are employed as casuals, and certainly issues to do with employment status and confusion over employment status causes a lot of problems in terms of people not knowing what their entitlements are. But if you want to know about your entitlements to statutory sick pay, go and look on the government website. It's to do with your earnings that you've had over the last 12 weeks. And if you reach the threshold level, then you are entitled. But I think one of the things that we need to develop as an agenda, really, of coming back to this point about humanisation, is to review the whole demonisation of people who are reliant on state support because of reasons of disability and issues to do with unemployment, and to recognise that these are workers' issues. They are trade union issues. They are about rights at work for workers who are out of the workplace, and that we perhaps need to build on an awareness of how awfully low these benefits actually are. You know, people have become really, really aware of that. So I think from an equality point of view, we need to bear that in mind too. We've come to the end of our time. So thank you very much, Roger and Faiza, for a really interesting and illuminating discussion. Thank you to participants for your questions and interaction. And we hope to see you for the next webinar or meeting or whatever it is that this coming together under the umbrella of IER. Thanks.
Thank you. Thanks, Aya.